Hello students, welcome to this session. So chapter 16. So in that universal or standard safety precautions, and in detail we will study hand hygiene. So in universal standard safety precautions, what are these and what are the components of that, like hand hygiene, biomedical waste management, protective equipments, injection safety and all. So these components we will see, and we will see hand hygiene in detail. So first, universal safety precautions. So these are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood or body fluids with non-intact skin or mucous membranes. The components are hand hygiene, personal protective equipments, biomedical waste management, injection safety, routine environmental cleaning, disinfection, then spillage cleaning, respiratory hygiene, appropriate handling of the linen. So these are few important components of the precautions. So let's study hand hygiene in detail. So hand hygiene is washing of hands promptly after contact with infective material. So there are different types of hand wash. So first is social hand wash. It is a common practice we do after using washroom or before the meals. Then second is hand rub. So here it is a use of alcohol based sanitizer. Then hand wash. So it is when the hands are spoiled, so that time we use antimicrobial soap, or then ordinary soap if the antimicrobial soap is not available. And then duration of this is longer than the hand rub, that is 40 to 60 seconds. And then surgical hand wash. Before the surgery we do hand wash up to elbow. So here you can see the steps of hand wash. So here for the hand rub, when we are using alcohol based sanitizer, so total steps are 7, and for hand wash when we are using water and soap water, then it is, or liquid soap, then it is total steps are 10. So first you have to apply hand rub or liquid soap or soap. Then in step 2 you have to rub palm to palm. Then in step 3 back of the palm, both the sides. Then step 4 between web spaces of the fingers. Then step 5 back of the finger on the palms, both sides. Then thumb in rotational movement, both the sides. Then step 7 you have to scrub your nails on the palms, both sides. And then this is for the hand rub. So for the hand wash, now you have to rinse hands with water, then dry with single use paper towel or tissue paper, and then close the tap with elbow if the handle is there, or with the tissue paper, and then let it dry. So after use of tissue paper. So these are the steps. So first 1 to 7 steps are for hand rubs, and 1 to 10 steps are for the hand wash. Now there are 5 moments of the hand hygiene where we have to do hand wash or hand rub. So 5 places or 5 moments are, so first is before touching patient. So before we go to see patient, then when we want to take pulse, blood pressure, temperature, or palpate something on abdomen or any abnormal thing, so that time before touching the patient. Then before doing any aseptic procedure, so like taking blood sample or catheterization or giving injection, so before doing aseptic procedure we have to clean our hands. Then in third, after body fluid exposure risk, so if you are touching any urine bag or blood sample of the patient, then we have to do hand rub or hand wash. And then fourth, after touching patient, so after taking pulse, blood pressure or palpation, we have to do hand hygiene to protect ourselves. And then 5 is after touching patient surroundings, so like we are touching patient's bed rails or trolley or stand, IV stand. So if we are touching anything surrounding the patient, then we have to do hand hygiene. So mostly in hospitals there is a hand rub or hand wash solution is there at the bed of the patient. So before and after we can use that solution for our hand hygiene. So these are 5 moments of the hand wash: before patient, before touching patient, before any technique, then after contact with blood body fluid, after touching patient, and after touching patient surroundings. So these are 5 moments of the hand. These are my references from which we can study. I hope this session you will find useful. Thank you.